We're going to start with a pregnancy test, and this is very much like the home pregnancy test you would buy at your local drugstore. Most of our kit tests have what I like to refer to as the idiot sheet, which is basically picture instructions that show you exactly what you're supposed to do. Okay. The package insert will contain much more detailed information, so if you have any questions, you need to make sure to refer to that. The nice thing about these kits is most everything in here is included in the kit, and in this particular pregnancy test, even the little pipette that we need is in there. So the first thing I always do is label my cartridge so I know who it is. That way, if I'm setting up multiple ones and I bump into one and it gets moved, I don't lose track. Okay. For this particular one, we're going to add 3 drops of urine just into the sample, and it says S right there. That's where the sample is going to go. And then discard this in the biohazard. Then what we would do is set a timer for 5 minutes. Each kit's going to have a different time that you work, so make sure you know your times, both the minimum and maximum. You can see the specimen start to migrate across here. This is the test line. That's what the T is for. This is a control line, and the control line is an internal QC just to make sure that our test is working. If at any time you have a test where the control line does not come up, that test is invalid, regardless of patient result. And if you notice, as it migrates across, the background also clears. Okay, magically now it's 5 minutes later and my timer goes off. If I had a positive test, there would be a line at the test and at the control. A negative test means the control line is there, but no test line. And again, anytime the control line is missing, the test is invalid, regardless of patient results. So I would report this as negative for the presence of HCG, which is a hormone produced in a pregnant woman. In this particular case, we are looking for an antigen in the patient, so the test cartridge contains the antibody, because we always use the opposite of what we are trying to find. So HCG is our antigen. We're using a tagged antibody to determine if there is human chorionic gonadotropin present.